Hello everyone. So coming to the second video of INICET recall, as this is a recall session, तो अगर आपको लगता है कि क्वेश्चन के लैंग्वेज में कोई सिग्निफिकेंट चेंज है या फिर इफ यू विल रिकॉल सम अदर क्वेश्चंस, ट्राई टू राइट इट इन द कमेंट सेक्शन. Okay. So this is the 11th question. A bedridden patient has partial thickness skin loss with shallow clean ulcer. Which would be its stage for pressure sore? It's a very commonly asked question and pressure sore की classification बहुत ही बार सबको पढ़ाई जाती है फ्रॉम यूजी to the notes that we prepare, and multiple questions were also there in the Q bank, and also this question has been asked previously in INICET and NEET as well. So I guess it won't be any difficult for you to solve this question since there are partial thickness skin loss. So it would be a grade 2 pressure sore, and the classification is, this is the classification, like first is non blanchable erythema, then second में partial thickness skin loss होता है, थर्ड एंड फोर्थ में फुल होता है, बट देयर इज अ डिफरेंस कि फोर्थ में देयर इज डैमेज टू मसल बोन और सपोर्टिंग स्ट्रक्चर्स एज वेल. नाउ दिस इज द क्वेश्चन, विच ऑफ द फॉलोइंग इज नॉट यूज फॉर कंट्रोल ऑफ कोविड 19. सो बहुत सारे क्वेश्चन ना कॉमन सेंस से भी क्लियर क्लियर हो जाते हैं, लाइक कोविड 19 का कंट्रोल करना है सपोज, तो कफ एटिकेट शुड बी देयर, यस. मास्क शुड बी देयर, यस. वैक्सीन शुड बी देयर बिकॉज इट विल प्रोड्यूस द हर्ड इम्यूनिटी, while ivermectin is not even used for the treatment as well as prevention of COVID-19. So the answer is ivermectin. JAK inhibitor, which of the following JAK inhibitor that is used for ulcerative colitis? So, I want to tell you one thing. JAK inhibitors are wonderful drugs. Well, from last 2 3 years, multiple conferences it has been discussed, and they are being called as JAK of all diseases. Like they are given in the most of the diseases, in most of the cancers, blood cancers, and in autoimmune diseases as well. And they are wonderful class of drugs. In most of the diseases, they are the first line treatment as well. So they are the most popular drugs nowadays, and that's why the multiple questions are asked on JAK inhibitor. In my super specialty exam, also three questions were asked on JAK inhibitors. In my MD final exam, also I got a long question on JAK inhibitors. So if you will be giving another INI set or NEET PG, I would really recommend to study in detail about JAK inhibitors. And if not on not and you will be taking admission in PG, then also you will need to know about this drug even in medicine or pediatrics or dermatology. Okay, so tofacitinib is a JAK inhibitor. Ustekinumab is IL-12/23 inhibitor, which is used in ulcerative colitis. Secukinumab is IL-17 inhibitor, which is used in ulcerative colitis as well as in psoriasis. Imatinib is a tyrosine kinase inhibitor, which is most popularly used in CML. The answer is tofacitinib. Which of the following is a PARP, poly-ADP ribose polymerase 1 inhibitor? So I could get only one option from you guys. So that is the correct answer only, Lucapirib. Okay, and it is used as a chemotherapy in multiple cancers, especially in ovarian cancer and prostate cancers. Vacutainer used for HbA1c estimation. So it's a very commonly asked question. And also अगर आप लोगों ने इंटर्नशिप में काम भी किया होगा तो you will know कि HbA1c का sample we send in purple oil, which is the ADTA oil. Okay. Hagma, that is high anion gap metabolic acidosis, is seen in which of the following conditions? तो कमिंग ऑन टू फर्स्ट डायरिया. डायरिया में जहाँ पर भी यू हैव टू रिमेंबर वन थिंग, जहाँ पर भी जीआई इन्वॉल्वमेंट होगा या रीनल ट्यूबुलर इन्वॉल्वमेंट होगा, वहाँ पे क्या होगा, जीआई से भी एब्जॉर्प्शन आराम से हो सकता है, रीनल ट्यूबुल से भी एब्जॉर्प्शन आराम से हो सकता है. वी हैव टू चेंज आयंस देयर. तो वहाँ पे हमेशा नॉर्मल एनायन गैप, अगर एसिडोसिस होगी देन इट वुड बी नॉर्मल एनायन गैप. तो डायरिया में क्या हो रहा है, देयर वुड बी बाइकार्बोनेट लॉस, बट वहां पे सिंस जीआई की म्यूकोजा है तो देयर वुड बी अ एक्सचेंज ऑफ फाइनेंस, सो इट वुड बी अ नॉर्मल एनायन गैप मेटाबॉलिक एसिडोसिस. Similarly, renal tubular acidosis में it would, since renal tubules are involved, it would be a normal anion gap metabolic acidosis. In vomiting, there would be loss of acid from the stomach, so it would cause metabolic alkalosis. While in decay, there is a high anion gap metabolic acidosis. Another cause of high anion gap metabolic acidosis is lactic acidosis. A child is able to draw a cross and say stories. What is the age of the child? So this question मतलब milestone पे majorly एक question तो आता ही है. So I would think कि आप सबने correct ही किया होगा. Since a child is able to draw a cross, he would be of age 4. Again say stories, which is another clue. अगर आप एक भूल भी जाते हो तो again the age of 4. So the age of the child would be 4 years. Now which vitamin deficiency is caused by ileal resection. It's a mistyping. It's a ileal resection and presents with posterior column neurological problems. So as we all know that ileal resection leads to vitamin B12 deficiency, one thing. And another thing also that there is a posterior column neurological deficit, which again favors B12 deficiency. Now, which culture media is used for Mycobacterium tuberculosis? I could collect only two options from you guys, and answer as we know is LJ media. It's used for Mycobacterium tuberculosis, and it takes some time to grow Mycobacterium tuberculosis. Another question is: a farmer presents with ulcers and nodular lesion on forearm with axillary lymphadenopathy. Which of the following can be the cause? So as we all know, this is the most common presentation of sporothrix. So the answer is A, sporothrix. All the best, guys. And if you can remember some other questions, you can just write it down in the comment section. And if you think some of the questions are wrongly uh, dictated here, then you can just tell me in the comment section. All the best.